This is Nevada Cancer Coalition's Cancer Talks, a public health podcast where we connect with coalition members and partners to learn more about cancer prevention, early detection, and survivorship. Hear about cancer care in Nevada and meet the people who are making an impact. We are joined today by Jamie Casden from the University of Nevada, Reno. You are a student there. Tell me a little bit about yourself.
Hi, yes, I'm a senior. I'm studying public health. I will be graduating this spring. And then my goal is to go to medical school eventually and become a practicing physician.
We definitely need more physicians in this state. So, congratulations. I think that that is a great job direction. So, how did you connect with Nevada Cancer Coalition?
It was kind of as my friends and I wanted to bring AMWA, the American Medical Women's Association club, back to UNR. It was previously on campus, and then the club had sort of expired, and my friends and I wanted to bring it back, and Lily was really willing to work close with us and help us find fun events to volunteer at, and it was mainly at the Paint Nevada Pink celebration for breast cancer awareness in October that I had the opportunity to get involved with the Nevada Cancer Coalition.
How big is the group right now?
We have about 25 members right now, and our exec board is full. So it's been really fun getting to know new people who want to join the club and just have active members joining.
That's exciting that in just a few short months, you've built that organization into a full board and a good membership. What sort of things do the members do?
We have a very diverse group of members, which is something that I love about the club. We have people who are focused on pre med, pre nursing, people who want to go to occupational therapy, physical therapy, and there's also people who are interested in research and just overall women's health care. So there's a lot of women studying different things, focusing on different aspects in school. And then we get together and we do monthly meetings, and then we also do tabling events on campus, and then also some fun socials for the club.
That sounds like fun. It sounds like something that I think really is obviously bringing together women, but bringing together women who are in a STEM field, I think is important to feel that sense of community.
I think that's a really important point, and that's one of the main reasons we did want to bring this club back was to create a safe and welcoming environment for women who are, hoping to go into STEM fields and medical and health related careers because it can be dominated by males and it can be hard to find that space for women to just collaborate and be able to step into leadership positions and just feel that source, that kind of like social just collaboration with everyone. So that was one of our main things, and it's been really good. Everyone's really uplifting of each other and very encouraging when people are doing new things and pushing themselves.
That's exciting, and just a real sisterhood. And I read somewhere online that you were really passionate about mentoring and kind of being there for others who are pursuing a similar field. How did you become so passionate about mentorship?
Honestly, I think it started through my membership in Delta Gamma. I'm a senior now. I joined when I was a freshman, and throughout my time at UNR and learning what I was interested in and kind of paving my path, I started helping other girls where I could and just giving advice when people would come ask me about how I switched from because I was originally hoping to go to nursing school, and then I switched and figured out what classes I need and all that. But I really enjoy helping other people figure out where their career ambitions lie and how to get there, and then what do they need to get there.
What does AMWA do on campus? What are some of the outreach activities that you've done so far?
I think the best one that we like to do is tabling events because it's really good to just reach as many people as possible. We'll put a table in the KC Breezeway, and then we'll just put like decorations out and little candy bags. Sometimes we'll sell things to raise money for good causes such as the NCC. And we just have like little pamphlets and just educational tools to try to reach more people on campus and talk about whatever the month is sort of focused on, whether it's like HPV related cancers or cardiovascular disease in women. And then other things have mostly been sort of collectively off campus where we'll just identify, like, oh, this could be a fun volunteer event, or this could be a fun way to get together and just let everyone have some fun.
Do you find that university students are pretty receptive to health messages?
I think so. I think that university students are often very busy, but if you can catch somebody and they have a few minutes, I think most of them love to talk and learn about new, like, health-related things that they might not know about, and I think almost everybody is really interested in learning about preventative medicine and screenings and stuff like that, that they might not be aware of, and just when to start getting those screenings done, especially for women's health.
Yeah, there's huge changes happening in women's health right now, and I think we've got at-home testing for cervical cancer that is coming about, and, women are being diagnosed with breast cancer at younger ages, sort of that early onset. So, do you find that a lot of women that you encounter on campus are more willing to hear the messages that you have about those topics because you're speaking woman to woman?
I've never thought about it, but you know what? Maybe that probably could help. I think sometimes it's seeing like these things talked about from a friendly face rather than just like a lecture or someone you don't know, or maybe even a doctor that you aren't very established yet. Sometimes it can be nice hearing things from your peers, and especially coming woman to woman, I think it's probably nice. And I enjoy forwarding information to all of our members. When read about the home testing for the cervical cancer, I forwarded it to everybody, and people were like, "Wow, that's really great." And I think it's just good to pass along information.
Yeah, eh, that at-home testing is so cool.
Yeah.
So, what has surprised you most about working with AMWA? I mean, do you have support at a national level? What does that look like?
Yeah, I think that AMWA is really cool because each school, while it's a branch, we are connected to the national level. So we get all their emails, we know what's going on with conferences. There's a lot of opportunity to get involved with that kind of stuff. It is a little hard because we are all very busy with school to go to all these big events, but it's nice staying in the loop. And then I think the other thing that surprised me the most is the amount of women that do want to step into these leadership roles and share certain medical stories to the community that they may not have had a platform before. I have one of our members, she's super smart, and she's actually going to be giving a presentation on long COVID and how it impacts women at a higher rate. So I'm really excited to see that, and just I love when our members have the confidence to step up and give sort of presentations like that.
I feel like you guys are doing so much more than I did when I was in college. Just getting involved in doing presentations and really stepping up that level of professionalism.
Yeah, it's really fun. I'm happy that we were able to bring it back. I'm excited to help girls step into leadership positions so we know that it will continue, and we'll continue to work with the Nevada Cancer Coalition as well. I'll still be in Reno taking classes while I'm preparing to go to medical school, but I'm excited to be an AMWA alum and continue my membership as well.
You'll be passing the torch to someone else.
Yes.
What are some of the other organizations that AMWA has worked with in the community?
There are a bunch of pre-health clubs on campus. I actually have a meeting where all of the pre-health clubs get together and we discuss what everybody is doing. So we've worked with a good amount of clubs, honestly. Everyone just kind of shares each other's events and tries to just boost attendance. And we have the pre health conference coming up in May where we'll have every health club there, and we'll have panel speakers and kind of like little resume builder shops and whatnot to kind of work with all the other clubs and how do we can help the pre-med and pre-health community at UNR.
Do you think that there is a lot of momentum behind students going into health fields?
I think so. I think there's so many passionate students who have a lot of excitement and ambition for not only helping other people, but learning so much in science and learning to apply that knowledge in medicine. So I'm really excited to see what the workforce is going to look like with all these students headed that direction.
Thank you for joining us. We are excited to see what happens with you and what happens with AMWA and hope that your chapter continues to grow.
Yeah, thank you very much for having me.
Thank you for joining us for this episode of Cancer Talks. Learn more about us at nevadacancercoalition.org and catch more episodes of this podcast on our Substack or wherever you get your podcasts.